Welcome to another edition of Up Close and Personal. And we are joined by Senator Lisa Seminara today. Thank you so much for being with us.
Thank you for having me.
Oh, absolutely. Senator Seminara, you're a freshman with the 2023 legislative session that just finished a little while ago. And so let's talk a little bit about you before we get into some of the issues and what it's been like just going into the legislature. You served as a member of the Avon Board of Education. You've been very involved civically prior to legislatively.
Yeah.
You served the 8th District, by the way, which is a lot of towns.
Avon, Barkhamsted, Canton, Colebrook, Granby, Harwington, Heartland, New Hartford, Norfolk, Simsbury, and Torrington.
The Senate districts are very large, and they have to be, it's got to be quite time consuming to be able to hit all of those areas and make sure that people could get to know you a little bit. Some redistricting recently occurred, so people are kind of getting the lay of that land too. But prior to all of this, you are a licensed clinical social worker.
Correct.
And you, that's what you did full time? Are you still doing any of that work?
I still have my license, but I don't practice anymore, and I haven't practiced for many, many years. I am a licensed clinical social worker, but I'm also a mom of 3. When my oldest child was born, she was born with cerebral palsy. And I still continued to work for a while after that. And then I had my second child and then decided that I was going to stay home and really try to be a mom. And then I had a third child. But I did always stay civically involved. I started Avon SEPTA, which is the Special Ed PTA, and I'm happy to say that that's still in existence and still providing very much needed resources for people in not only Avon, but surrounding communities. I also started a nonprofit organization that we raised the funds, designed and built a fully accessible playground, which we gifted to the town of Avon.
Which is awesome.
Yeah, so proud of that.
Mm-hmm. And handicap accessible playground.
Fully accessible, and people still use that all the time. That's up in Buckingham. And I still volunteer for Amy's Angels and for Special Olympics.
That's wonderful. And your daughter, who you mentioned, Martina, is a recent graduate of Trinity College.
Correct.
Wonderful school.
Thank you.
And so you graduated yourself with honors from St. John's University, and then later got your master's degree in social work from Columbia University.
Correct.
And so now that mom time has, maybe gotten less, although always a mom, you've decided to throw your hat in the ring and say, okay, I'm going to serve the public in a greater capacity. So I think that it's part of your DNA, so to speak, to be giving back and to making your world a better place wherever Senator Seminara is, and she's many places, which we're going to find out. Many places. I don't know how you do it. So tell me, I think the folks at home would like to know, what made you come to the decision that, you know what, I think this is something that I'd like to do. I'd like to run for office.
For municipal or for Senate?
For Senate.
For Senate. Okay. Well, I was serving at municipal on the Board of Education. I really enjoyed it. And I really felt like it would be great to make change on a more macro level. And in all honesty, the party approached me. Kevin Whitcoast, the previous senator, was retiring, and they had seen the work that I had done in Avon, and they also wanted a woman. Mm-hmm. So they wondered, they approached me, we discussed it, and then I decided, I spoke with my family because honestly, it does affect your entire family.
It does.
And they were very supportive. So hence it started.
You decided.
I decided.
We talked before the interview started, and I think it's important to note, so I want to mention it now rather than wait. When you're running for election, things can be pretty divisive, right? You've got 2 sides or 3 sides or 4 sides, depending on who's running and how many are running. And then it gets to the point where there's a winner. The election happens, things are over with. Does that vibe continue during your legislative work, or have you found that it kind of goes away?
I have found that it kind of goes away. So, it can get very divisive during campaign season, whether that's municipal or on a state level, and obviously on a national level. But I have found, or my experience has been, that once I was elected, that sort of dissipated. And I feel that as a freshman, I worked very hard to cultivate relationships on both sides of the aisle, really just for the benefit of my constituents. I don't want to have a cantankerous relationship with the people that are in power, A, and B, I just want a good working relationship with everybody so that things can get accomplished. Mm-hmm. And I really found that people were really supportive of me. Once I was there, once I was up there, they recognized I was the senator, and people were really helpful to me. As a freshman, there's a huge learning curve. I'll be honest with you, and it's overwhelming in the beginning, and people are kind. They just want you to be successful. They want to be helpful. And when it all comes down to it, we're all human beings in the end. We may have differences, and it's okay to have those differences, but in the end, we're just people wanting to do what we think and what our constituents are looking for us to do.
And that's really wonderful, and I wanted that message to come across, because sometimes with the news, which is all we're receiving if we're not at the legislative office building or involved in the process, is we feel that it's quite different than that. And I've heard from not only you, but others who we've had the pleasure of hosting here, that is exactly how it is. That at the end of the day, it's about working together and getting the right thing accomplished instead of nothing accomplished because of a lot of drama and or divisiveness. So it's wonderful to hear. So that's very important. Now, you, and I noticed this we're going to talk about your committees, because you're ranking member on 3 of them. So not only are you coming in with a learning curve, you have to get to know people, you have to get to know the process, you have to get to know how the legislative aids work, all of that. Now you're ranking member on 3 different committees. Mm-hmm. How did that happen?
So the Senate Republican is a very small caucus. There's 12 of us in total, and there needs to be representation on every committee. Okay. So they usually ask you what committees you would like to sit on, and they ask you to rank them. And then the ultimate decision is leadership's decision. But they want you to be on committees that are of interest to you, committees that they think you will work well on, given your background or your history. So I am ranking on aging, children's, human services, which kind of lends itself to my background. And I also sit on education.
So really, the aging, the Committee on Children, I mean, you already had so much experience that you're bringing to that, as well as human services. So, there was probably much less of a learning curve, but more about the ranking membership and how that works and the leadership works. So let's talk about some of the work that you've done, because that's 4 committees. And we can start with the double-digit health insurance hikes that we've just seen. You're looking at folks saying to you, I can't afford that. I can't do that. And so these are things that you're you're thinking about on the health committee?
I think that came out of public health, which I don't sit on.
Okay.
But it is certainly something that we need to take into consideration. In fact, this session, especially with small businesses, there was a bipartisan bill that came forth that a healthcare proposal for small businesses, which would have included nonprofits, by the way, for small groups to form and to get healthcare insurance. There was a huge bipartisan push, and it was very disappointing to me that it never made it to the legislature, and so I'm hoping this upcoming session we're going to take a look at that and revisit that, and because I think that will help your small businesses, that will allow people to get very much needed healthcare coverage, and it will also assist, I think, in our workforce crisis, which we do have.
So in the 2023 legislative session, on the committees, let's talk about the Human Services Committee. What was one takeaway that you had coming out of that committee? Did anything get moved along with Human Services?
Yes.
And what was a key notable?
The biggest bill out of Human Services this year was 5001, which was a huge bipartisan effort. It was voted unanimously out of both the House and the Senate. And really what it looked to do was to evaluate and implement best practices for employment and transportation and housing for those with intellectual disabilities.
Okay.
Huge bill.
Big bill.
Big bill, like one of they call the omnibus bills, but had a lot of support. It addresses wait lists for, again, wait lists for housing and services for those with disabilities. And unfortunately, Connecticut has very large waiting lists, and people are waiting for services for years, which is years, which is not something we should be proud of.
Give us an example of that.
Especially with the autism community, the wait list, I don't remember the exact number, but it's for housing and sometimes for services. Yeah. Yes. It required a lot of it. The bill requires collaboration between all the different departments, which is good. It establishes a transition program starting at a much younger age. So for those with disabilities in the school district, you'll have a transition coordinator start early. So by the time you age out, perhaps you'll be ready for housing. Perhaps you'll be ready for employment. Perhaps you'll go on to some form of education. But that will all be in place. That's the plan, that we're no longer waiting and listing, and that should be a much smoother process. A big thing for me in this bill was in the northwest corner where a lot of my district is. We have no transportation, both for people with disabilities and without.
Elderly.
But in this bill, I could address the transportation issue for people with disabilities and employment specifically.
Wonderful.
Yeah, so that we're taking a look at the transportation and trying to offer people in transportation deserts, because there are some, and people with disabilities, that's a particular issue for them because many of them don't drive. So this bill really takes a look at that and tries to address that.
So folks who want to learn more about what's now going to happen, that this has been passed, it's 5001.
Correct.
And you can find information about that on your website or on the state website?
You can find it on the state website, but I might have historically, I've done weekly emails and I highlighted that bill many, many times.
Okay, so, and agencies know about this, obviously, that the passage, so they're going to start putting that into effect. And so instead of someone being behind the 8 ball waiting, there's going to be a trajectory that they can follow and have a good result. Because to age out, that's the problem. They age out of services, and then all of a sudden, there you are with nothing.
Yeah.
And that can be devastating.
And it can be, yeah.
The Committee on Children, that's very interesting.
It is a great committee. Again, I think huge bipartisan effort overall. This year, what came out of children's was safe storage and labeling and disposal of opioids. Recently, there was a huge report that came out, and there's such an increase in opioid in children, increase in actually infancy death with opioids with children. I anticipate that will continue, that we're going to need or want to continue to look at that.
Because of safe storage of medication?
Well, children are being born addicted to opioids. Families sometimes have opioid addiction in the household, and children are getting access to that. So we're looking to tighten that up. And one of the things we did was to anything that comes out of a dispensary or a pharmacy has a label on it, obviously, or that was the legislation now. So we're going to continue to look at that and hopefully make some changes there. We changed the licensure. So we changed the licensing fees for people, for licensed clinical social workers, LMFTs, again, to improve the workforce. We have huge workforce shortages.
Tell me about that. You mentioned that earlier before we started. I don't understand that in Connecticut. Can you enlighten us a little bit about what you know, because you know more?
So the workforce shortage is like in actually every one of my committees, it was brought up. In education, we're lacking teachers, and in children's, we're lacking social workers and people who can help with mental health crisis. And there's still a huge mental health crisis in our state. Unfortunately, some of it is residual from COVID, but I think overall, we really have had a mental health crisis for quite a while. The legislature, rightfully so, has focused a lot on increasing services for children. I'm totally for that. But one of the things that I have encouraged us to continue to look at is increasing services and availability for adults. And I say that because if you have a child who has a lot of mental health issues, it's certainly taxing on the parent. And sometimes you have a parent that has a lot of mental health issues themselves. Again, we've seen a rise in that. If you're an adult and you're not in a good place, you're not going to be available for your kid. And the bottom line is we need to make sure our adults, our parents, are healthy so that they too can assist with their kids.
So with the lack of workforce, that's presenting a lot of problems for social services for folks. If they can go, if there aren't places to address this easily, then it's not going to happen. Was there anything that came out of that committee that will allow for more mental health
access?
Well,
again, we're trying to encourage, we're doing everything that we can to encourage people to move to the state of Connecticut, and with those licensures and even the ones who are local to try to improve that. We're also taking a look at Medicaid rates, and we need to do that, and rates overall, to be quite frank. But in my committee, we focus on Medicaid rates, and the Medicaid rates, the reimbursement rates, are incredibly low. They're incredibly low. They have been for many years. And so what came out of the committee is a study to look at the Medicaid rates and what we can do to improve them. Because if we don't improve them, we are not going to improve our workforce.
No.
That's
happen.
the bottom line. It's just not going to happen. And we need to take care of the people who take care of our most vulnerable populations.
And aging as well.
Correct.
You're on the aging committee.
Correct.
And so does this cross over into that?
Absolutely.
Okay.
There are less and less people. People are living longer. Our aging population is growing. And there are less and less people interested in taking care of the aged population. And it's a huge problem. It's a huge problem.
Can you tell us one or two of the reasons the workforce is so low? Is it too expensive to live in Connecticut? Are young people going to college and then not coming back to Connecticut to work, going to Boston, going to the bigger cities? Is that?
I think it's both of those things. I think the cost of living in Connecticut is high. We're looking at affordable housing, of course, and that might improve the situation. But we pay very high taxes. It's an expensive state to live in. So I think that's part of it.
But the sleeves are rolled up, and it sounds like the process has begun even last session to say, okay, we have to make some changes here. We have to attract people to the state. We have to make it attractive to work in these areas because they are very rewarding, as you know, as a clinical social worker yourself. Very rewarding career.
I agree, and it weighs heavily on me that people don't see the value. But in all honesty, it takes a special person to either work with a person with disabilities or work with somebody in the aging community or to work with the sick at all. Let's face it, anybody who's ill, whether it's mental illness or physical illness, it's a tough population to work with.
But I've seen that it's a calling. It's a vocational calling,
Agreed.
really. The people that you see that are successful and that are balanced in their lives vocationally, it's a calling. They love it. I think of the nurses on the helicopter for Lifestar, who I know one. It's just a calling. We only have about 3 minutes left.
Wow.
I know.
Oh my God, that goes by so
it goes by
fast.
so. I want to just touch on the automobiles. I was happy to see that you were out at an event with Senate and House Republicans in opposition to the ban of the sale of gas-powered vehicles by the year 2035.
Yep.
And let's just say that it's not that there's an opposition to going green, because obviously that's not it, but rather kind of just slowing down a little bit. And why we would need to slow down, you've got some great things on your website. I'd like you to hit them quickly. Why do we need to just take it back a little bit?
Yeah, I think we need to put the brakes on, no pun intended, because there's a lot to take into consideration. And quite frankly, all the stakeholders are not feeling confident that we will be ready in time. So we need to think about charging stations, or lack thereof.
Right.
There are not enough charging stations. They gave an example during the press conference of the Capitol. For how many people that work there? 15,000, 1,500 or whatever it was. I don't remember the exact number. We have 2 charging stations, 2. So you need to take into consideration, we are going to need to build that up. And especially thinking about in our cities, where there's more density. Where are all these charging stations going to go? How are we going to be able to accommodate that? The grid is another issue. The grid, and again, you can talk to all the stakeholders involved. We're not ready. And they don't think, I know people say, well, it's 12 years away. It's 12 years away, but 12 years goes by very fast to put in place this type of legislation. This is huge legislation.
And I would have to save 12 years to be able to afford one of those vehicles.
That's right.
I mean, they're not the affordable choice.
And there's discussion and that, manufacturing will change and the prices of the vehicles will most likely become affordable. Well, what's affordable? Because what's affordable for me or what's affordable for some is not necessarily affordable for someone else.
A family.
Right. I just think that we are following California's lead.
Yes.
And that goes back to legislation that was passed way before I got there. But things have changed. And in this situation, and the other thing that people don't think about or that isn't talked about, there's a lot of mechanical issues that need to be worked out or that go along with this. But what about a choice?
Right.
Not everybody wants an electric vehicle. So it comes down in part to choice. And you're taking choice away from the constituents. And it's just a tough thing.
And then the other thing that I was glad that you put on here was the concerns about the lithium ion battery disposal, which is a whole nother thing. All these batteries that would then be there, and then the impact where we're buying them from. There's so much about that. So please, I encourage you to go to the website for Senator Lisa Seminara, and you could read more about that if you'd like to know more. I want to thank you so much for your time today. In fact, we didn't even cover half of what we kind of wanted to. So we have to make sure that you come back.
I would love that.
Oh,
Thank you so much.
And
if I could just encourage people to sign up, I do a weekly email where I really put a lot of time and effort. My team and I put a lot of time and effort into it. I think we put really great information, whether you're in my district or not. And to sign up for that, you just go to senatorseminara.com and sign up for my weekly email. And it's very informative, and I get high praises everywhere I go, and I am many places that people really enjoy it. They find it very educational and sometimes funny and just a good thing to do.
That's great. Well, you're delightful. We're so happy to have you, and we look forward to seeing more from Senator Seminara. And for now, I'm Joni for Nutmeg TV. Until next time.